Anxiety and depression medication warning, and this one actually concerns me the most. 92 million prescriptions in the US. That's ridiculous. 20% of the population at any one time on these meds, but this concerns me, I think, even more. Benzodiazepine, which are anti-anxiety meds used during pregnancy and the increased risk of miscarriage. It's a twofold increase. Now, this is why you have to get this information to these moms. If they knew that statistic, I believe they would opt for an alternative. But look, CBD, if you put in the chat CBD, not all CBDs are created equal. The one that I use, my coaches use, and my doctors, will send you a link to get it. Also, if you don't want CBD, Kava, Kava, put that in the chat. Kavaplex, great product.
Wow. I want to just provide some comments about this video. 92 million prescriptions. So 33% of Americans, that's a little bit about 100 million people in the United States, suffer from anxiety disorders. They're diseases that require clinical intervention. What are they supposed to do? They're supposed to tough it out. We need to prescribe as psychiatrists, as doctors, and patients who are suffering from these disorders need to take the medication to get better. Then the video continues to talk about pregnancy and just one study in isolation about benzodiazepine use and increase in miscarriage in pregnancy. This video does not talk about the detrimental effect of anxiety disorders in pregnancy. The moms who are suffering from agoraphobia, from severe OCD, panic disorder, the effects that these illnesses have on the fetus and on the mom. A mom who's so anxious that she avoids going to her OB and does not get routine care. The mom who doesn't exercise because she's so anxious and overeats and binge eats because she's so anxious, and that increases her weight. Diabetes, high blood pressure during pregnancy. So what are the effects? What are the risk factors of all of these? We as psychiatrists, we as doctors prescribe these medications, taking into account the benefits and the downsides before we prescribe these medications. Surprisingly, this continues to talk about a marijuana product, the CBD and Kava, to be an alternative to pregnant women for better outcomes, I'm assuming, which is honestly ridiculous. Products that are little to no clinical studies about their harmfulness, about their efficacy. How can they be an alternative for a pregnant woman? How do we know what are the risks that we put that woman and the baby in? Please talk to a psychiatrist if you're suffering from an anxiety disorder in pregnancy. We will leave some resources here in the caption. Be safe out there.